How's it going, guys? Nurse V here. So today we're going to be talking about the cardiac CT calcium score, also known as a heart scan, and it's essentially a non-invasive test that takes a look at your heart through a CT scan to examine any potential coronary plaque that may be accumulating over the years. So we know that coronary plaque is composed of fatty deposits, cholesterols, and calcium, which over time can contribute to the reduction of blood flow to the heart, and this can lead to something called myocardial ischemia, which can cause a heart attack. So this is why coronary calcium score is important to determine the severity of the atherosclerosis of your coronary before symptoms start to become noticeable. What's great about this test is that it provides important evidence that can let your doctor determine what their next plan of care may be. So essentially, the test is painless and it's non-invasive. So how do patient prepares for the test? How is it performed? And really, what can you expect from the test after? So depending on the facility that you go to, the doctor places an order. So on the day of the test or on the day leading up to the test, they're going to ask you to avoid any type of stimulant, such as caffeine, nicotine, or really any type of medications that can stimulate your heart. Some doctors may prescribe you on a beta blocker, which is a medication that kind of lower your heart, so something like a metoprolol. And the reason why is getting your heart lower to around 60 beats per minute really helps to ensure the quality of the heart scan. Electrodes are then placed on your chest. They're going to monitor your EKG just to make sure you're not having any arrhythmias. And then you're just going to lay still on the table. They're going to slide you through a large imaging machine like an X-ray. X-ray would then take different cross sections of your heart, which essentially takes a few seconds. No IVs needed. No contrast is given. It's essentially painless. Once the images are all compiled together, the amount of calcium deposits can be calculated using a quantitative scoring system called the Gatskin scale, which ranges from 0 to 1,000. Essentially, the higher the score, the more calcium deposits are found. So a score from 1 to 10 equates to being very minimal. A score of 11 to 100 equals to being mild. 101 to 400 equates to being moderate, and then anything really greater than 400 is going to be high. Okay, so all right, you got the score done, you got this calcium score. What's next? What am I supposed to do? Well, really depending on the severity of the score and what your symptoms are, your primary care doctor or the cardiologist or whoever's ordering this test will use that information to figure out their next plan of care. They might consider placing you on a lipid-lowering medication like statin to kind of get your cholesterols down. They might do something a little bit more aggressive like a PCSK9, which is a lipid-lowering injectable medication. Or they might place a cardiology referral to discuss further advanced cardiac testings, like something invasive like an angiogram, to really get down to the crux of it, right? Who may be benefited for this test? Who is this test indicated for? Well, if you're between the age of 40 to 70 and you're at risk for any coronary risk disease or CAD, or really if you come from somebody with a very strong family history of coronary artery disease, those are some of the indications of why you may be consider having this conversation with your PCP about getting this test done. Risks and limitations of this test. So again, getting any type of imaging from a CT, there are going to be some risk for radiation exposure. 1 to 2 millisieverts is the range, which equates to being about 1 to 2 years of background radiation that people are generally exposed to. So in other words, the amount of radiation someone exposed to through this test is generally safe. So go ahead and talk to your doctors about it, see if there's something that may be recommended for you if you're within that age populations or if you come from a strong family history of CAD. But there you have it. That's a heart scan. That's a coronary calcium score.